My name is Julia Bennett, and I'm going to be presenting Dorothy Orem's self-care deficit theory. I'm with Athabasca University, and this is Nurs 608. A little background on Dorothy Orem. She was born July 15th, 1914 in Baltimore, Maryland. She received her diploma of nursing in the early 1930s. She then went on to receive her Bachelor of Science in Nursing in 1939. Dorothy wanted to continue her education and received her Master's of Science in Nursing in 1945. Dorothy created the self-care deficit nursing theory. The self-care deficit model focuses on individuals performing self-care. It's the act of assisting others in the provision and management of self-care to maintain or improve human functioning at home level effectiveness. Helping patients to care for themselves to recover more holistically and quickly by participating in their self-care. And it identifies 5 methods: acting for others, guiding others, supporting another, providing an environment of promoting development, and teaching others. A practice scenario would be Mr. Smith is a 69-year-old male patient being admitted to the general surgery unit, post-operatively following a laparotomy with loop ileostomy creation. Mr. Smith had an epidural with bupivacaine and hydromorphone placed in the operating room for pain control. Mr. Smith is independent with activities of daily living at home before the surgery and hopes to return to his baseline following surgery. Once being on the floor overnight, Mr. Smith is finding increased pain to the abdomen and does not feel he is achieving pain control with the epidural. The nurse assigned to Mr. Smith wishes to ambulate with him first thing this morning and assist Mr. Smith with morning care. This applies to practice and applies to Dorothy Orem's self-care theory in the scenario because the nurse identifies that the patient is independent at home. The nurse assists the patient to the side of the bed and sets him up with water, soap, and face cloths. As the patient is having poor pain control, the nurse can identify that the patient will not be able to perform care independently. The nurse allows the patient to wash their face in front of their body, while the nurse washes the back and perineum for the patient as he is unable to bend. This is an example of Dorothy Orem's theory, as the nurse allows the patient to be independent as possible while assisting the patient with the things that they are unable to do. The patient feels empowered for doing part of their care independently, as they did not think they would be able to, and wishes to try to be more independent tomorrow. If I were to be able to have a lunch with Dorothy Orem, I would provide a very quiet, intimate setting where we would be able to discuss nursing theory and nursing practice. Questions that I would have to Dorothy Orem about the self-care deficit model would be, how would you suggest using this theory with a patient with poor pain control management post-operatively? Because oftentimes patients will refuse their care, and as a nurse, we must respect autonomy and respect the patient's decision. Therefore, we will be unable to perform care for that patient and not able to apply Dorothy's theory. The second question I would have would be, how would you suggest applying this theory to a patient who is unmotivated and unwilling to participate in self-care? Which I would ask this question as the same as the first question, as we must respect patients' autonomy and cannot force patients to get washed out. So I was hoping that Dorothy might have suggestions on how to maybe motivate the patient or how she would navigate the situation. The last question that I would ask Dorothy was, do you think that this theory is still applicable to patients with dementia or cognitive impairment? And I would ask Dorothy this question because patients in these conditions can often be confused and might not quite understand what's going on. Therefore, I was just wondering if this theory would still be applicable in this situation. And these are a list of my references, and thank you for listening to my presentation.